Greetings, everyone. My name is Salima Koksum. I am a psychiatric and mental health nurse practitioner, and today I'm going to do a presentation on suicide prevention. In this presentation, we will define suicide and terminology associated with suicide. We will have an overview of suicide statistics. We will be discussing populations at greater risk for suicide. We will have an understanding of social determinants of health that impact suicide. We'll be identifying suicide warning signs and behaviors. We'll review steps to suicide prevention, and we will have an understanding of where to get help. Suicide is defined as a death caused by injuring oneself with the intent to die. Suicide is simply ending your own life. A suicide attempt is a non-fatal, self-directed, potentially injurious behavior with the intent to die as a result of the behavior. Suicidal ideation refers to thinking about, considering, or planning suicide. You can see that the overall suicide rate in 2021 number of final deaths was 48,183 deaths by suicide. That increased to 49,449 deaths by suicide in 2022. So there has been an overall increase of 2.6% in the number of deaths by suicide from 2021 to 2022. Overall, suicide rates have risen by 16%. This slide continues with suicide statistics, but the demographics is going to be by age. We can see that the highest rates of suicide are between ages 25 to 44 years in both 2021 and 2022. Suicide is currently the 11th cause of death in the United States. 3.5 million adults made a plan to commit suicide in 2022. 1.7 million adults attempted suicide in 2022. There is one death by suicide every 11 minutes, and 2022 is the year of the highest number of deaths by suicide on record to date. Some of the populations at greatest risk for suicide include middle-aged adults, minorities, veterans, members of the LGBTQ community, and tribal populations. Contributing to the populations at greatest risk for suicide are the social determinants of health. So some reasons individuals are committing suicide include racism, discrimination, economic hardship, poverty, unemployment, lack of educational opportunities, and barriers to physical and mental health. Although we cannot definitively predict when someone's going to commit suicide, there are some warning signs or suicidal behaviors that we can look out for. Someone currently talking of suicide or planning, someone that's displaying extreme mood swings or emotional instability, someone giving away valued and prized possessions, someone that has changes in patterns of sleeping and eating, someone that may have experienced some painful losses due to maybe death, divorce, an incurable disease or disability, and someone that has feelings of hopelessness, helplessness, and worthlessness are among some of the warning signs that we can look out for someone who may be contemplating suicide. In order to initiate suicide prevention, we want to identify and assist the person that is at risk. Ask the question, do you feel like hurting yourself? Listen, be non-judgmental, empathize with the individual, and if you're not sure, do a safety or welfare check by calling 911 and report a mental health crisis. You can call or text 988, or you can get the person to the nearest emergency room. Remember, if it's A high risk of suicide, stay with the individual until help arrives. Suicide prevention is not just the prevention of suicide for others. If you feel like harming yourself, or if you know someone who is thinking of self harm, dial 911. Dial or text 988. That's the Suicide and Crisis Lifeline. Go to the nearest emergency room and ask for help. The Veterans has a crisis line. You dial 988 and then you press 1. Dial 911 and request a safety or welfare check if you think someone's life is in danger or they may be contemplating suicide.